Nearly a year into the pandemic, teenagers and children across the country are facing a mental health crisis. Many are still dealing with the stresses of virtual classes and social isolation. And for some, this is also coupled with trauma, food insecurity, and a parent's job loss, or even the death of a loved one from COVID. Meg Oliver is outside an elementary school in Little Falls, New Jersey, with more on the story. Meg, good morning to you. I'm really glad you're talking about this.
Gayle, good morning. Experts tell us depression is on the rise among children and teens. At the beginning of the year, we spoke with an 11-year-old boy dealing with depression. Now, about 6 months later, we met up with him inside his school to see how he's doing. 5 days a week, sixth grader Rocco Testa leaves home to attend school in person in Little Falls, New Jersey.
Hi, it's so nice to see you again.
We first met Rocco in late August when he bravely opened up about his mental health during the pandemic.
It was just me being angry at the world and everything because of COVID and stuff.
Like most children, Rocco spent last spring inside, learning in front of a computer. Isolation took a heavy toll, but many of his frustrations faded after he returned in person this fall.
Are you still mad at the world?
No, not really at all.
You feel happy?
Yeah, I feel a lot happier.
In September, it was like my kid was back.
Rocco's mom, Gina Testa, is a guidance counselor in a nearby district where school is only virtual.
My students are suffering. They're breaking down. I have parents that are on Zooms with me crying about what's going on with their kids at home.
For many children, as the pandemic has raged on, their mental health has continued to suffer. The CDC says between April and October, emergency departments saw a more than 30% spike in visits from children 12 to 17 years old for mental health reasons. Across the country, millions of kids are still attending school only remotely.
Do you feel the kids that are learning virtually, their mental health is declining?
100%.
Sherry Glassman is a school psychologist in Rocco's district where there's a hybrid program. Some students in person and others are virtual.
Our virtual students are dealing with a lot of isolation, a lot of screen burnout.
Glassman credits Rocco's improvement with early intervention, proactive parents, and returning to school in person.
How many calls do you receive a day from parents worried about their children?
At least 5 to 10 calls a day, and it's all about mental health issues.
Dr. Maria Yarovi is a pediatrician in New Jersey. She said the calls she gets are about kids as young as kindergarten through college.
What are the biggest signs you should look for if you think your child is really struggling?
Not wanting to be involved in activities, not wanting to eat, just staying in their room, sleeping.
In a September survey, more than half of children ages 11 to 17 reported they had thoughts of suicide or self-harm, nearly half or every day in the previous 2 weeks. They were also more likely than any other age group to have moderate to severe symptoms of anxiety and depression.
What should you do if you think your child is going to harm themselves?
Straight to the hospital.
And what should you do if you think your child is depressed?
Get help. Get absolute help. Call a psychologist, call somebody, get help for them and for the family.
Rocco told us speaking publicly to us about his mental health has also helped.
That definitely made me feel happy and like a lot better that I was making an impact on other people.
It's not easy to talk about your mental health. Do you realize that that was a really brave thing you did?
Yeah.
Why is it so important to keep this conversation going?
Because it definitely normalizes these feelings and it ends that stigma of mental health issues. I mean, there should be no stigma around it. People need to talk about these things and know that other people are going through the same things they are.
One clinician at a mental health care facility here in New Jersey told me they are overwhelmed by the number of calls from parents of struggling kids. As we face this mental health crisis, Rocco's school psychologist says she hopes bringing kids back in person is prioritized. Tony?
All right, Meg, thank you very much. Bravo to Rocco for speaking up.
Yeah,
Tough issue.
That's what I was going to say.
Got better. We like to hear that.
Remember, we all reacted and thought that was so brave. I know he's not going to want to hear this, but he's a very good-looking little kid. Very good-looking little kid. And so I praise him and his mom for allowing them to come and talk so candidly.
Yeah.
And I like the fact that he's owning it, saying, yeah, he's glad that he did it, because it will help other kids.
Yeah, and it does get better. I'm glad he's feeling better.
It does get better.
All right, Meg, thank you very much.